Okay, well, I'm going to introduce our grand round speaker, Dr. Jane Clougherty. She is a professor in Drexel's Department of Environmental and Occupational Health. Her training was at Harvard School of Public Health and University of Chicago. She had a stint in New York City's Department of Health, and she started her academic career at University of Pittsburgh before going to Drexel. She is an exposure scientist and environmental epidemiologist, and she studies environmental hazards and urban air pollution and temperature extremes and how they interact with social and psychosocial stressors to influence health outcomes. And her work has shaped how researchers understand environmental health disparities in cities. And I hope that I gave that a broad but broadly correct description of your work, and we're really looking forward to your presentation. Thank you.
Thank you so much. Alrighty. Hello, everyone. Thanks so much for being here today. It's really a joy to be here and have the opportunity to speak with all of you. As promised, I am going to be speaking about social susceptibility to air pollution and extreme temperature today. I'm going to be talking about the dreaded climate change. Yes, we are going to be talking about that. And to get us started, let's see. Things are moving. I'm going to start by acknowledging that we're all working in a really unique climate today, both in terms of the politics and academics, and so much is changing in the area of environment and health and climate and health today that I just really want to acknowledge that climate means a lot of different things. So when we're talking about climate and health, we're talking about aspects of the physical environment, we're talking about aspects of the social climate or the social environment. My fascination academically is understanding that interaction in between, and we're also working and surviving in a very rapidly changing funding climate and research climate. So I want to acknowledge that elephant in the room and recognize that a lot of us are working in very stressful circumstances today. And it's a hard time to be a trainee going into environmental health, because understandably there are questions around what is the future of environmental health and how are we going to keep going in this research world of environmental health and environmental epidemiology. So I've been thinking about that a lot lately, want to acknowledge that, and also want to acknowledge some of the teachings that we learned from Darwin, who was arguably in history one of the scientists who thought the most about resilience and survival as a species and otherwise. And he's famous for having been quoted, well, for among other things, but his probably most famous quote, "It is not the strongest of the species that survive, nor the most intelligent that survives. It is the one most adaptable to change." And I want to point out that that's where most people stop. And maybe there are some lessons to be learned for this moment and for our field by continuing along a little further, that lives within the means available and works cooperatively against common threats. So that's what I want to offer, is the idea that living within the means available means making the wisest and most creative use possible of the resources that we do have at this moment to help our field stay strong. And working cooperatively against common threats means knowing who our friends are and learning new ways to work maybe collaboratively in the research that we do rather than competitively. And arguably our competitive grant-driven world has maybe offered less emphasis on the latter point than has always been best for our field. For those of you who are still trainees, this may be a great moment to hide out and build your chops in environmental epidemiology and environmental health and not have to worry about research funding and the job market quite yet. So there is possibly some strategic opportunity to this being a time to focus on training and skills building. And what I've been offering to my grad students to help keep, their optimism up through this challenging period is the perspective that this is a very unusual time. We've been through hard times before in environmental health, but this is an unusually challenging one. But if you're facing some of the most challenging times that our field has had this early in your career, you are unstoppable in the future, right? Think of it as building your resilience and your ability to keep charging forward. So with that, let's talk about some science. I'm really fascinated, as I mentioned, with the interplay between the social environment and the physical environment. The environment or climate does not mean one thing. It means a lot of different exposures, both social and environmental, meeting populations at once and shaping their health. So there is evidence that lower socioeconomic position populations are arguably more susceptible to the effects of air pollution and extreme heat, but for many reasons, for many years, we haven't known why. You need me to talk into the microphone, don't you? Okay, I'll try to stay over here, but I like to walk around a lot. I'll do my best. But we haven't known why. And the hypothesis that I kind of put forward early in my career is that perhaps chronic stress or the experience of living a precarious life or the experience of feeling yourself to not be as wealthy or as highly status driven as those of your neighbors or others in your city, because in our American culture, education and job indicate a lot about status as well as wealth and resources in a tangible sense. They also have this psychosocial positionality sense about them. Perhaps it is something about that chronic stress of living in more precarious circumstances that in and of itself alters how resilient individuals are. And there's a construct that was put forward by my late colleague, Bruce McEwen, referred to as allostatic load. This is basically the composite of complete effects of chronic stress and its impacts on immune, endocrine, and metabolic function over time that just may make individuals less resilient to anything and everything else that they encounter in life. That could be chemicals, that could be viruses, that could be pollutants, that could be extreme heat. But it's basically wear and tear on our overall system that may make the impacts of environmental exposures more profound. So I started out back when I was a graduate student in Boston. So these are the years 2001 through 2006. I just recognized today that I am 20 years out of the gate this year. Oh my God. Um, wow, where did the time go? But this is the very simple conceptual model that I started out with, and it's gotten an awful lot more complicated over time because as we learn more, we also learn how wrong we are and how many things that we really need to validate along the way. So we're going to start with the simple model and make it more complicated as we go today. So what I proposed was simply that air pollution and extreme heat may impact upon health outcomes. Also, psychosocial stress may impact directly upon health outcomes. And this thing that we call stress through processes of allostatic load or collective impacts in our immune system may alter how we respond to extreme heat and temperature. Very simple interaction model. And I started by testing this in my doctoral thesis. So this is a study that I did eons and eons ago, but it was so much fun. We looked at a cohort of children that was born out of the East Boston Neighborhood Health Center. In East Boston, some of you may be familiar, is kind of the figure-8 shaped community that surrounds Logan Airport. Do I have a pointer? It's okay if I don't. Yeah, it's all right, we'll go with it. Don't worry about it. So the homes marked in various shades of red are the cohort homes where the children were living, and the color coding indicates their estimated nitrogen dioxide exposure. And I built a simple land use regression model to estimate nitrogen dioxide exposure, long-term annual average at each one of the child's homes using data that had been collected by Barry Ryan and his son every single month for 20 years in and around the Logan Airport grounds. And we looked at the association between estimated NO2 at each child's home and their likelihood of developing asthma over the course of follow-up. And we found, and then stratified it by exposure to violence, reported both by the child and the parent. And we found a really fascinating thing, which is that for the children who had below median exposure to violence, that's low ETV here, they had basically no increased risk of developing asthma in response to air pollution. But among those children who had elevated exposures to violence, they indeed were quite susceptible to the effects of traffic-related air pollution as indicated by NO2. Odds ratios of 1.6. And then when we reduced just to those kids who always lived in the same home, that is, we're reducing our exposure misclassification, we saw the effects go up quite a bit to a 2.4, which suggests, not always, but often in epidemiology, when we reduce our exposure misclassification, if we see the effects go up, we seem to see the effects moving away from the null. It suggests we're getting towards something of a real association. Okay, so that was a fascinating result. And of course, everybody asked, what did you not adjust for? And what's wrong with your cohort? And this is crazy. What are you talking about? This stress thing even matters. So we got some animals and we recreated the same study. We said, okay, with animals, we can actually randomize. So tell us what else might be going on. We got 24 Sprague Dolly rats and we cross-stratified them into 4 groups. That is stress, non-stress, filtered air versus concentrated particulate exposures, pulling in air from Huntington Ave in Boston, shooting it directly to the animals. And what we found was that for an animal who is undergoing a chronic stress paradigm, which you see demonstrated here on the left, versus an animal who is not undergoing a chronic stress paradigm, the stressed animal, in response to the same increase in fine particulate air pollution exposure, had a significantly higher respiratory frequency, significantly lower peak inspiratory flow, significantly lower peak expiratory flow, significantly lower tidal volume, significantly lower minute volume. So what was fascinating here is we were seeing not only a statistically significantly different effect, but actually a substantively different respiratory profile, a different respiratory pattern being set up in response to the same air pollution exposure among an animal that is going through a chronic stress paradigm versus an animal that is not. And this is when people started to believe us. Okay, maybe there's something going on here. Maybe you're not totally crazy. This is a more recent result. I worked with a graduate student hang by at University of Pittsburgh and colleagues out at UC Davis in California who have phenomenal animal resources. One of the largest veterinary schools in the country is there. And among their animal resources is they have one of the world's largest outdoor housed colonies of rhesus monkeys. And those rhesus monkeys lived through the California wildfires. And monkeys do us a huge favor that they stress themselves out. Monkeys live in natural social hierarchy. They will fight out social status within their group. So we didn't have to stress them, and we didn't even have to justify this to IACUC. The animals are doing it themselves. And what we learned, oh, this did not advance. I'm sorry. Let's see, can we make this advance? There it is. It advanced on my screen and not up here. Okay, apologies. But when we looked at just the female monkeys, the fighting and social status pattern was a little bit more complicated in the boys. But among the girls, what we see is that for animals born during a wildfire year, we can see on average dose response effects of increasing, these are measures of respiratory function with higher social rank within their tribe. For animals not born during a wildfire year, we saw basically no effect. So in a way, what we're doing here is we're flipping the interaction the other way around. And we're saying perhaps what's happening is that during times of stable environmental conditions. These are animals who all have equal access to housing, veterinary care, food, all of the material conditions of life are taken care of for these animals. The only thing that's different is their social rank that they fight out among themselves. Okay? We don't normally see that. When environmental conditions are fine, all the animals are doing great. But under conditions of environmental duress, in this case, under heightened air pollution exposures, that's when we can see that animals of higher social rank seem to be more resilient. Wow, that's fascinating. Let's keep moving forward. So there's been kind of a growing literature over the past 2 decades trying to figure out this idea of stress pollution interactions and what on earth might be going on. This work has been done looking at a lot of different chemical exposures now, a lot of different outcomes, and there's really been some beautiful work trying to elucidate the mechanisms or which kind of specific stress-related mechanisms may be impacted either by the pollutants that we're concerned about and or stress directly. This paper I really like by Erickson and Arbor, they're really focused on newborn outcomes, but I like how they put together this framework thinking about particulate air pollution just as one exemplar environmental exposure and the social environment. And they think about factors at local and regional source levels and community level factors for the social environment and start to think about the many different pathways that may be at play following either pollutant exposures or chronic social stressors on down to ultimately what they pointed out was excess placental oxidative stress and inflammation as as an outcome from both pathways that may actually act together on fetal outcomes. It's a really beautifully detailed example of this work. So I mentioned that we started with a really simple conceptual model, and we're learning more as we go, about how complicated it could really be. So now I'm going to show a little bit of how I and my group have dove in to understand air pollution and extreme temperature exposures a little bit more clearly, particularly in large urban cohorts. So Gigi had mentioned that I spent some time at New York City Department of Health. I was there from 2008 through 2010. And the work that I did for them was to design and manage the New York City Community Air Survey, which I think to date is still one of the largest monitoring systems that have been run within one city anywhere in the world. So we ran about 155 monitors year round for 2 years at that point, and then brought it down to smaller scale monitoring ever since throughout all neighborhoods of the city to get down to fine scale variation in air pollution and temperature. So we modeled down to about 100-meter grid cell size. So we were able to do this for particles, metals, components of fine particles, a large suite of gases, temperature and humidity as well. So this gave us really fine scale day and location specific exposure estimates, and it drove a lot of policy change in New York quite quickly. And a great example, the reason I'm showing you this nickel map here is that this one was really powerful in driving policy change in New York. Nickel, airborne nickel, is associated with neurocognitive outcomes in kids. That scares everybody. And it is particularly emitted from number 4 and number 6 oils, which tended to be burned in very high volumes in New York in the large old industrial boilers of the big buildings in Manhattan that could handle the cheap crud dirty oil, right? Everything else is number 2 or distillate used in smaller homes with smaller boilers. And what we found here, and this is what really shocked everybody, is the highest concentrations were in the Upper East Side. And I think had this map been released to New York Times and what we showed was the highest exposures were, say, in the Bronx or Harlem, nobody would have been surprised, right? And it probably would have flown right onto the radar screen. But because we showed the highest exposures of a neurocognitive toxin in the wealthiest communities in our country, people went crazy. And, people with a lot of wealth and political power demanded change really fast. And within a year, the city council was outlawing number 4 and number 6 oil burning. So, but as a knock-on effect is that because that change was made, that drove down concentrations within Upper Manhattan, but then likewise drove down, I'm showing you on the right, fine particle concentrations throughout much of the rest of the city as well. So there were additional benefits to many other communities, but certainly politically, that's where the drive came from. And this work has also supported a lot of great fine scale epidemiology we've been able to do since, having much more resolved measurements at 100-meter daily level than we've been able to in other large cohorts. I'll show you some examples as we go forward. And I've also used these methods over the course of my career to look at time stratified spatial distributions across many monitors in urban areas to support policy formulation in other cities as well. So for example, when I was at University of Pittsburgh, I did a lot of work with Allegheny County Health Department, focusing on organics composition of fine particles. We were able to do the same kind of monitoring across a lot of locations focused within the downtown core of Pittsburgh to understand rush hour versus non-rush hour concentrations of organics compositions in fine particles. And we even did some work to help them figure out the wisest allocation of bus routes through the downtown to keep buses flowing as efficiently as possible to not have buildup of certain pollutants of concern in certain areas. So we've done a lot of elemental and organic source apportionment with this work. Used this work in New Zealand quite a bit, which is my second home and a place that I love to work in, to look at things like wood smoke markers, particularly following the Christchurch earthquakes during reconstruction there when people were burning anything and everything to stay warm because so many houses were destroyed. And we've also used this in Auckland, New Zealand to understand effects around shipping ports, for example. So those are some ideas of the very different sources we've been able to disentangle using this approach to think about monitoring organic and inorganic components of fine particles across many places for specified hours of the day. And then we've embedded hybrid and dispersion modeling into classic kind of land use regression approaches to sort of understand geographic resolution in exposures. All right, and one really fun example was written up, I guess, almost 2 years ago now in National Geographic. This was a huge thrill for my lab. We had been doing some of this spatially saturated source apportionment monitoring in collaboration with Philly Thrive, which is a community-based group in and around South Philadelphia, really concerned with particularly benzene and BTEX exposures from the Philadelphia Energy Solutions refinery that was operating in South Philadelphia until it exploded in June of 2019. But since that time, during the decommissioning process, not surprisingly, there's a lot of fugitive emissions that are continuing to be of concern to the community. So we worked with them to develop this fine-scale spatially stratified monitoring campaign in their community that gave them some data that they felt like they could believe. And one of the cool things that we've shown is that although this community has very legitimate long-term exposure concerns because they've been under the shadow of this refinery really for decades, as we were able to show that concentrations were indeed decreasing, they were able to believe that and have some relief in that, because they wouldn't have believed the data that was coming from the industry, they wouldn't have believed the data that was coming from the government or from the city, but they were willing to believe third-party academics that say, yep, we're working with you to co-design this system, and we are indeed seeing numbers decreasing. And they said, that's great, good, let's keep it going. Okay. All right, so I mentioned that the New York City saturation work has supported a lot of epidemiology that we've been able to do to date. And this is work with my dear colleague, Perry Sheffield, who's at Mount Sinai in New York. And there we were able to do some of the earliest work looking at extreme temperature as a predictor of health effects in young children. So this study was really focused on, it came to be focused on children in the 0 to 4 age range, but initially we were looking at children from 0 all the way up through young adulthood at 18. And we were able to look at nonlinear relationships between extreme temperature and emergency department visits, and to break them out by diagnostic category. And there were a few surprises in the diagnostic categories that we've been able to build on to date. So for example, there are some we use emergency department and hospitalizations data that I'll describe in more detail in a moment, which is referred to as SPARCS. But one of the great things about SPARCS is we can break all of the visits out by diagnostic category, but a lot of physicians try to do us a favor when they call something heat specific when it comes into the emergency room, but that doesn't actually help us. We would rather not infer the exposure to what the outcome is, but just tell us what is presenting as the health outcome. But in addition to the stuff that was called heat specific, we saw a lot of injuries and we saw a lot of mental health visits coming up in young people. And those were a surprise. We weren't as surprised by respiratory events or gastrointestinal events, but wow, interesting. There's something going on with injuries and mental health around heat. And that's something we've been taking forward since then to explore further. We also were surprised to find that the strongest effects were in the smallest kids, again, 0 through 4, rather than from, say, 5 to 12 or 13 to 18 years old, which said, wow, that's interesting to us. The smaller kids tend to spend more time inside, so why would an ambient indicator of temperature have more predictive value in young children for health outcomes? But, maybe there's an air conditioning story here. Maybe there's a lot else that we have to understand about what is driving these effects, especially in small kids and who are apparently quite susceptible to heat. So that's been the impetus for a lot of our work going forward that I'll wrap back to in a second. I mentioned that it's not advancing with me. There it is. I mentioned that this story, the conceptual model, is going to get a little bit more complicated as we go. So let's talk about psychosocial stress. Stress is a hard thing to measure. It's a really hard thing to measure objectively because guess what? It's not objective. Stress, by definition, from psychology, is the perception that the challenges in your life, whatever they may be, are overwhelming to your resources and capabilities to meet those challenges. Okay, and the stressors in everybody's life are totally different. So how do we capture this in a meaningful and reproducible way across large populations where when I'm working with millions of kids in emergency department data, I can't contact them. And even if I could, it wouldn't be realistic to go back and do millions of surveys, though I wish I could. Instead, we have to find indicators, right? So we have worked with a lot of indicators over the years, and it's really not advancing. Hello. What am I doing wrong? It's advancing on the screen in front of me. It's not advancing up here. Um, I mean, I can just keep talking. I can talk all day. That's not a problem. All right, so. Stop sharing the slides, release sharing. Ah, I took it out of slideshow mode. It's still in slideshow mode up here. We'll just go with it. All right, so I can't interview millions of kids, but I can use indicators that we find in GIS, our best friend, Geographic Information Systems. We can look at administrative data and look at things like violence and crime events, or indicators of physical and built environment, access to healthcare, noise. We can look at noise exposures or indicators of socioeconomic position. Bear in mind, if we're using something like socioeconomic position, we're combobulating material in psychosocial pathways. And if we're really interested in separating psychosocial pathways, is that going to give us what we need? So we also have to think about, so when we're using indicators, we have to think about how do we validate them? I can't go back and interview those million kids in my emergency department data, but I can do focus groups and surveys with other populations throughout the city. So that's what we did. So we ran focus groups citywide. Every single focus group wanted to talk to us about violence. It's the only thing that was raised by every focus group, regardless of how safe or unsafe by objective indicators their neighborhood was. And we also did surveys citywide where we asked people, where do you live? Geocoded them to their nearest cross street for anonymity. And how stressed are you? We used perceived stress scales. And what we were able to learn using that data, we had point level indicators of chronic stress from the surveys, and we had geographic indicators of stress or exposures, and we were able to look at associations between the two. And what I'm showing you here is one example of perceived lack of safety as reported in our surveys in response to area assault rate. And we found that yes, indeed, people who live in a location that has a 1 IQR interquartile range increase in area assault rate, likewise, those individuals are likely to report, well, we see twice the odds of reporting a perceived lack of violence in those communities. So check. People know when they live in an area that has a higher crime rate. Okay, so we did see corroboration of both perceived exposures to violence and crime and perceived stress in response to area violence. And that was by far the strongest stressor that came through. And most of the effective violence, we believe, is working through psychosocial pathways rather than obviously material pathways. So that's great. So violence has proven to be, in the New York City setting, for purposes of our work, a fantastic indicator of psychosocial stress. And we've used that in a lot of our work going forward. Big caveat, that will not work everywhere, right? Violence happens to capture inter-individual variation in perceived stress in the context of New York City. Probably works well for other Northeast cities, but other settings, it could be something very different. It could be poverty. It could be housing insecurity that are major stressors in other locations. So when you're looking for indicators of psychosocial stress, you need to validate them in your population, okay? So we have since made the model even more complicated. Once we validated that this thing called stress was reasonably approximated by violence in our setting, we started to ask questions about the community stressors, the appraisal process that led up to stress, and ultimately other buffers that may intervene in this stress process and therefore foster resilience in communities. Okay, I'll talk a little bit about that in just a moment. But first, I'm going to introduce you to this Sparks data set that I mentioned, which is basically, it is run by the New York State level Department of Health. And what they do is they require by law all emergency departments, hospitals, and clinics within New York State to report patient level data into one aggregate system. And as a result, for the state of New York, they have exhaustive data from every single emergency department and hospital. And what's beautiful about that is you have complete case coverage. So you're not going to be beholden to the unusual catchment area or the unusual population characteristics of any particular hospital in using the data. So we love this geographic coverage and the ability to look in an even way across communities of all different types, both in the city and statewide. I'm going to show you some data here among children aged 5 to 17, just under 12,000 asthma events, and just focusing within the warm season for ozone exposures. This is some of our work trying to understand climate-related exposures as they impact child health with variation by violence as our validated stressor. These are conditional logistic regressions, symmetric. Oh, that's funny. It's a time stratified case crossover design. Symmetric bidirectional was the sensitivity test. Should have swapped that a long time ago. And we're adjusting for Tmin, that's daily minimum temperature, humidity, and PM 2.5 in these models. And here's what we saw. Looking at associations between ozone and asthma events in the Sparks data, we see that there are significant associations between ozone and risk of asthma on lag days 1, 2, and 3. So not surprisingly, it's about a couple of days lag effect between ozone exposures and when we see kids coming into the emergency department with exacerbations of asthma. But what's really of interest to us is the difference across these 4 quartiles, which are increasing violent crime exposures within each of these communities. And what we tend to see is higher violent crime confers a stronger association between ozone and risk of an asthma exacerbation. So that was really fascinating to us. And we've been looking at this in other variants ever since. But I do want to point out one kind of exception to this rule, which is really fascinating. It's in the idea of saturation effects and threshold effects in interactions. So interactions are not likely to be linear, right? And what we've seen in some of our work, here's an example done by Rich Remigio, where he looked at birth outcomes, also in New York City, but NO2 as the exposure of interest. And what he found was that consistently, children in higher violence communities indeed had lower birth weight. That was very consistent in the data set. But the interaction between violence in those communities and the effect of NO2 was surprising. What he found was in the highest quartile for violence, NO2 didn't have an effect anymore, right? So you can almost think of the interaction happening only up until a point when you've basically got your system saturated. At some point, for very high violence exposures, very high NO2 exposures, those babies are very small, the kids are quite ill, but you can't see the effect of pollution anymore, okay? So you can almost think of it as diminishing marginal returns. So at a certain point, when the stressors are really quite high, you really can't see the effect of pollution. And that's been intriguing to us, is kind of developing ways and methods to think about nonlinearities and thresholds in these interactions and how to capture them better in our work. And I promised that I would talk a little bit about community assets and buffering that stress process, because our model just gets more complicated by the day. This is work that we did with partners across upstate New York, government, clinical, and community partners, and we were trying to identify assets within communities that appear to buffer the associations between climate-related exposures and child health outcomes. This is the huge suite of assets we were looking at within all of these communities. Again, a lot of this work is done in GIS and identifying those databases that allow us comparable measures of any given community asset across the whole of the state. There was huge interest from our partners in schools, in transportation, and in broadband access. Those were things that we heard a lot from our community partners in particular as huge determinants of health or huge potential resilience factors upstate that are very different than what we might see in an urban environment. So we've had to do a lot of rethinking of all of these interactions and all of these both stressors and resilience factors as we move from an urban to a rural setting. This work was terminated last year by EPA because improving children's resilience to environmental exposures is no longer within EPA purview, apparently. Surprising times, but we are now repackaging this work and trying it as an R01, taking out all the newly bad words. So we just have to get creative in how we pose some of this work today, talk a lot more about resilience than about stress, and talk a lot more about rural communities than urban communities, but we are being resilient to reframe, repackage, and stay alive one way or the other. Okay. We did see some early preliminary results from that work before it was terminated, indicating that across all sorts of communities in the state, rural, small town or suburb, low density urban or high density urban, we did see significant effects of, in this case, as an example, fine particulate air pollution exposures on all-cause child emergency department visits. And we saw them particularly elevated on the case day, not on subsequent days. And that was consistent across all parts of the state. We see some interesting nonlinear effects on PM 2.5 across the state. So here we're comparing the effect of 6 micrograms per meter cubed versus 1 microgram per meter cubed. And you can see that's where we get much larger percent excess risks in comparison to the additional marginal effect of PM further out on the exposure curve. And then finally, the last slides show you effect modification by poverty, where we saw something surprising, which is that, again, this is showing at the low end of the concentration curve, we see the highest per microgram per meter cubed effects, marginal effects. And only in the high density urban do we see significant effect modification by poverty, but it goes in the opposite direction. So we are seeing stronger effects of PM in wealthier communities, only in high density urban. We refer to this as the Manhattan effect in New York, because we have some of the wealthiest communities in our country are also some of the most highly polluted, and sometimes even in a case crossover scenario, and even doing our best job possible to adjust for all of that social confounding, that is still kind of a persistent effect that shows up in this data a lot. Okay. I want to jump ahead a little bit. I'll mention a little bit of work that I'm doing on synergistic effects with other colleagues out at UC Davis, taking advantage of other awesome animal facilities that they have out there. My colleague Tony Wexler runs a concentrator system at the Caldecott tunnels outside of Berkeley, where they're able to pull air in directly from a tunnel vehicle exposure from a highway and expose animals directly to it. And we cross-stratify those animals with stress, as I showed you back at the beginning of the talk. And we're doing that again now. We are still funded on this R01. I guess they didn't recognize this as an environmental justice inspired R01 because it's an animal study. So let's be quiet about that. And what we're doing is something really cool, which is that we're playing with the timing of the exposures of the stressors and the pollution, and we're doing continuous cardiovascular monitoring throughout. One of my co-PIs on this, it's a three MPI grant, is Chao Chen, who's an expert in autonomic function and heart rate variability. So she's monitoring the animals continuously for autonomic function as we're playing with the timing of the exposures, and we're basically asking, is it that the stress alters the animal's response to the pollution from the tunnel, or is it that the pollution is altering stress signaling in the animal? So which way does the interaction go? my hypothesis and what we're seeing thus far for these primary pollutants, which is what we're getting out of TRAP from the tunnel, traffic-related air pollution from the tunnel, for the most part, we're seeing more effect. That stress seems to be modifying the air pollution effect. But Ermila Codavanti and others have shown that for ozone, the effect can actually go the other way. And the reason why is that ozone is such a strong respiratory irritant that at some level, the animal almost perceives itself to be suffocating a little bit. So when the exposures in question are ozone, we see a little bit more of the opposite directionality in the interaction. Super fascinating stuff to try to tear apart these mechanisms a little bit better. I want to wrap up by offering 2 thoughts on future directions going forward. This is future direction number 1, which my lab is diving into now. One of the unique challenges in this moment where environmental funding has become so much more challenging than it has in the past, is that if we flip the interaction around, another way to think about it is it doesn't matter if your work can be funded right now. So it's a great opportunity to do those things that are hard to fund in the best of times, including research on gun violence. Okay, gun violence is always hard to get funding for, but we've been fascinated for a very long time to dig in deeper on our data to understand fine scale modeling to estimate day and location specific violence exposures as a stressor, really working as fine scale in those measures as we do for air pollution and temperature, and getting those interactions right and testing that interaction in all directions. I also, and part of this work is also thinking about projections of violence going forward under climate change, because just like temperature and air pollution, violence is projected to increase quite drastically over coming decades. So homicides are projected to increase by about 6% globally per degree C. And globally, violent crimes are projected to increase by about 2.3 to 3.2 million events by the end of this century. And there have been a number of other studies, and the estimates do bounce around quite a bit, but suffice it to say, through a couple of different mechanisms, it is expected that as global temperatures increase, we will be seeing increases in violence for a number of reasons. There are 2 kind of major hypotheses that have been put forward to explain impacts of heat on violence, and one is basically direct aggression impacts, and this has been tested in fMRI studies and also in controlled experiments where they'll have, for example, police officers in training are quicker to pull a gun in simulation scenarios in an overheated room. So heat makes people crabby and more aggressive. The other major theory is routine activities, which basically says when it's warm out, people don't want to be inside, especially if they don't have air conditioning. People are out and about, and maybe they're a little bit crabbier. And being out and about more, having more social interactions is also more opportunity for social altercation and conflict, right? Putting that together, so those are basically individual level interpersonal theories, but likewise with climate, there are impacts to be expected on displacement, forced migration. Obviously, resource scarcity and water scarcity can lead to conflict over coming centuries. And the more that we have conflict over resource scarcity and the more children especially are raised in times of severe conflict, then we have potentially intergenerational effects. So there's a lot to be concerned about around climate change and violence. What my group wants to tear apart is using very fine scale data in huge numbers to look at kids. We want to understand, first of all, the direct effect of violent crime events on stress using mental health visits as a proxy in the SPARCS data. We want to understand what proportion of the effect of heat that's known to impact health and physical health is actually mediated through exposure to violence. We want to understand whether or not mental health effects on kids are modifying or altering relationships between climate-related heat or air pollution on physical health. So it's that whole nexus and complicated interaction that we're really setting out to tear apart. We have applied for an R01 to help us tear this apart. Again, violence work is hard to fund in the best of times. Now is an opportunity. Let's just charge forward. So we're using the Sparks data, about 7.5 million emergency department and hospitalization events in kids. For mental health, we have about 400,000 events to work with, and we got our grubby little hands on NYPD point data. So we have day and location specific violent crime events for about 1.5 million events throughout New York City over about a 15-year period. So it's a pretty rich set of data to tear this apart. Violent crime is usually reported at police precinct level, which are big gross areas and annual average. A lot of that is done in social indicators for anonymity, of course, but we're interested in getting a lot more fine scale. So when we look at our point level data, which is on the right, you can see there's no comparison in terms of the geographic resolution we can get from each, and likewise temporal resolution, because one is annual average and one is daily. So that's where we're going, and working out the inflection points, so to speak, critical time lags and critical distances for the influence of violent crime events on child mental health to get those associations right, and then use that metric going forward for all the other associations I talked about. All right, and then finally, to wrap up, I want to say a few words as wrapping back to the theme I introduced at the very beginning of the talk, that we are working through a crazy, unique time in environmental health. And I think that, as I offered, this may also be an opportunity to rethink how we manage our field, how we do work in our field, how we reach our maximum productivity, and how we're sustainable over the long term. So I want to invite more brainstorming and crazy thinking about opportunities for moving forward in environmental health and environmental epidemiology, because we can all whine to each other all day about how challenging things are. But, sometimes when the floor drops out and the world is burning, it's also an opportunity to rethink everything and rebuild anew. So my colleague, Michelle Bell, who is at Yale, some of you may know, she and I put out a survey about a month ago, just a broad blast to people in environmental epidemiology, just saying, blue sky, crazy ideas, throw it out there. Give us anything you can think of. And we're going to start compiling the crazy ideas that we've received, publish that, start distributing that, and we're really eager to start the conversation going on thinking about new paths forward for our field. And I want to encourage that perspective, and very open to having that conversation. I also want to acknowledge all my partners, collaborators, the people in my lab who do the real work, all the funding that we've had, terminated or not, over the years, and say thank you very much, and I appreciate all your time and attention today. Thank you. So I'm very happy to take any questions, or if anybody wants to take the opportunity and throw out crazy ideas for our field, please do. Yes.
Great presentation.
Thank you.
I have a question.
Okay.
I think I'll ask kind of like the fun one.
Okay.
So one of the more interesting words that I've seen is of course primatology.
Cool.
And then social activity within primate communities
Uh-huh.
tends to vary on an hourly level, or
For the boys, yes.
Be very drastic.
Yeah.
Different. So how exactly do you control for that to account for what could be maybe the animal handlers wearing masks or wildfire? Little things like that could trigger changes in social hierarchy within the primate colony.
Okay.
How do you control for things like that?
Interesting. Okay, so one thing I've learned from my primatology colleagues, so this is John Capitano and Lisa Miller out at UC Davis, and I rely on their expertise. One thing that's really come through clearly in their colonies is that for the boys, you're right, they're fighting constantly and social hierarchy changes very, very often. For the girls, it's very stable. The girls tend to inherit their mother's rank and stay pretty stable throughout the life course. They don't fight as much. So that's really interesting. That's why the data that we reported in that paper was girls only. Super interesting, right? One of the things that makes it so challenging to look at the rank data in the boys, we've seen this in our data, is the middle manager effect. And for those of you who aren't familiar, the middle manager effect in stress is so fascinating. So kind of the outdated old ideas of stress was that the CEO was always, the person in charge of everything at the top would always be the most stressed. No, no, no. It started to be more like the people who have less control at the bottom appear to show more stress. But the middle manager effect is that you are constantly fighting up to try to gain your own rank at the same time as you're fighting down to keep these guys from overtaking you. So the middle rank male primates in their colony get tons of exercise. So in terms of cardiovascular fitness, they're outrageous, right? So it's really, really hard to interpret their data. But you're right, that's one of the cool things about primates and one of the many millions of things that make them so fascinating to study. Yeah.
Great presentation.
Thank you.
If you looked at does the behavior monitoring?
I would love to look at sleep because one of the things that happens when people are chronically stressed is their sleep falls apart, right? So I suspect it's on the pathway from perceived stress to immune or endocrine function, certainly metabolic function, ultimately health outcomes. Where exactly it fits in there, I think is a little bit hard to say. One of the things with stress is, at least in the epidemiology, we're always trying to separate the direct psychosocial effect from the behavioral effect, because you can choose to smoke or drink or other things to cope with stress. And that might be secondary exposures that are attributed to the stress, but the pure psychosocial effect itself is sort of a different thing, and the underlying essence we're trying to get at that's actually very hard to directly measure. But I suspect sleep could be part of that. It's hard to know. It sort of sits in that space in between direct stress and behavior. I don't know. I think it's a very important part. I'm also very concerned that if you live in a place where you don't feel safe, you don't sleep well. And I think that could be one of the many pathways, particularly for violence on stress. Oh, okay. Hi. Oh, can I unmute somebody? Dare I?
I think it's just me that has the hand raised. Is it
I
me?
hear it from here.
Am I sounding like God?
Yeah, we can hear you.
Okay, good.
At least I can from this speaker, but it's quiet.
Oh, okay. I'll try to speak up then. This was so interesting. I really, really loved your presentation. Your work sounds so cool. Thank you so much
Thank
for
you.
taking the time to be here today. Um, I have two questions. One, what do you think the result, like what are your thoughts based on what you know now of the result that you might see with this like very pinpointed, discrete violence with the gun violence and stress coming from that? What do you think the result of that is going to be, especially when you are talking about kind of this idea of lagged time and how that might be important on not only health outcomes, but also like maybe the perpetuation of violence in those areas. And then also, I was prompted by the sleep question earlier to think a little bit about maybe like the microbiome, if you've thought about how that might be impactful here. Because I know that that can be important, especially if you're seeing a lot of impacts on the younger kids, how that can be different through life. So.
Okay, interesting. Let me take the second one first, because for me it's easier because the answer is I don't know. Um, I don't know much about the microbiome, so I have to defer to colleagues who know an awful lot more about that. I don't know how stress affects the microbiome, but I imagine it's profound, again, through both direct and behavioral pathways. There was some work I did about a decade ago with a dear colleague, Fernando Holgen, where, not surprisingly, we were approached by a European nutritional supplement manufacturer to look at the effects of nutritional supplementation as a buffer on both stress and asthma exacerbations. We didn't find much. But they had some reasonable pathways around oxidative stress and inflammation, but we did not see a huge effect there. Microbiome, I don't know enough about to answer that question, but in terms of nutrition, we didn't see a whole ton. The prior question was around gun violence, lag effects, and I think acute stress effects and chronic stress effects. I sort of heard the question going in that direction. So right now, in our very preliminary exploration of the data between gun violent events and mental health events among kids in New York, what we're seeing is something of maybe like a 1 to 2 day lag, which is kind of interesting because we don't know if that means that you don't have mental health exacerbations until you think about it the next day, or you don't feel safe leaving the house that first day. So it's not until the next day that you get to the emergency department, right? So it's making us think in very different ways about how people are choosing to access healthcare for mental health in the immediate aftermath of, say, gun violent events, you know, on their block or right in front of their home, because it's really that level of spatial proximity that we're looking at. So we are seeing an effect in the hypothesized direction, but not until a day or even 2 days later, and we don't know why yet. And again, that's all very, very, very preliminary, so please don't quote me on that. One thing that's going to be very hard to tear apart, and I sort of heard your question going in this direction, is the difference between acute and chronic stress. So our bodies evolved to deal with acute stress, right? We have HPA signaling for a reason. You know enough to jump out of the way of a charging vehicle, just as your ancestors once knew to run away from a saber-toothed tiger. We evolved to have an acute stress response. That's fine. There's nothing wrong with acute stress. What's bad is when the acute stress is day after day after day after day after day, or you've lost glucocorticoid signaling or receptors response in such a way that your body is no longer responsive to acute stress in the same way. So your acute stress system, your cortisol patterning over the course of the day pretty much craps out. So usually chronic stress is where we see susceptibility and health effects, not acute. And that's one of the conceptual problems we have to deal with in that study, because we're really looking at acute stress processes when you look at a gun violent event in your community and kids going to the emergency department for mental health events. It's really bad. It's a really extreme stressor, but we're much more concerned about the kids who have that experience repeatedly, and we're pulling them out as a separate subset of the data set, or kids who are having that experience within a community of a chronically high crime rate. That's a whole different experience than a rare individual acute stress event. So that's all, very much to be determined, and we're very, very early in that work. By the way, I can't help but notice there is active shooter guidance up on the podium here with a QR code in case anybody would like to look at that. Yeah.
That's exactly what you're going to do today. We'll take the two questions together and then address them because we're in the comments.
Sure, yeah, please. Oh, hi, Anna.
Oh, I'm sorry. Maybe Anna, Antonio, and Anna, if you could hear your questions.
Hi, Jane. So super quickly, that was fascinating. I know you're studying heat because of the whole climate change, but after the past couple of months in Minnesota, I was wondering if you've thought about extreme cold and how that might have a completely different set of maybe triggers. I don't know. Maybe that's not even a thing because I don't deal
Extreme
with
what?
temperature.
Cold. Oh, yes. Yeah. I have not done a lot on extreme cold. I absolutely agree. Both extremes are bad for you. We have a comfort range for a reason. That's where our body biologically lives. That is going into our next R01. I can't tell you much yet about variation in susceptibility to extreme cold, and that's one of the reasons why we're expanding our work from New York City across all of New York State, because the variance in climate and temperature is actually quite drastic from, say, New York City up to like Adirondacks National Park. And we can look at longer bouts of extreme cold higher up in the state. It's a great question. I don't know the answer yet. Oh, thanks. Oh, yes, please.
I actually had pretty much the exact same question, but I have another one just in case. I was wondering, right, because you talk about these extreme heats, and I've experienced that exercise is a very good way of releasing stress, right? And I think
Could you speak up a little bit? I'm having trouble hearing you.
oh yeah, sorry, is this better at all?
I think so. Go ahead.
Okay, so I know that, exercise helps with stress, like going for a run or a bike ride and things, especially in these summer months. But with the extreme heat, you might be more inclined to stay inside or less motivated, like you were saying, and cause maybe more buildup of stress by even not being able to go outside and exercise. But also now when you go for a run, you're doing more mouth breathing and potentially exposing yourself to more pollutants because you're skipping that impaction pathway of your breathing through your nose that removes those higher pollutants or particular matter, and like how kind of you can maybe model that if I guess if you're exercising more in these polluted areas, if you're actually exposing yourself to more stress because you're just getting more of these pollutants. That kind of makes sense.
Okay, I had a lot of trouble hearing your question, but I think it's around exercise and maybe modification effects if you are unable to exercise very often in perhaps very cold or very hot settings, and how that may mediate or modify effects of cold on health. Was that the question?
Yeah, basically. I'm sorry. I don't know why you can't hear me. I'm trying to figure it out.
Yeah, great question. I do not know the answer. I think it would be very worth exploring. I think exercise is definitely one of those behavioral pathways for stress on health, separate from the psychosocial pathways. And of course, seasonality and exposure to sunlight would be part of that as well. As of right now, as we're thinking about cold and heat gradients across the state for New York, we're thinking about the difference between heat islands in the city versus lesser heat island effects in rural areas, and maybe lesser access to heat infrastructure in rural areas. But I think you raise a good point about behavioral patterns and exercise and how those differ seasonally. Yeah, we'd have to think about that really carefully. And I think there's also the difference between indoor and outdoor exercise. So yeah, lots to tear apart there. I can't make any promises that we would be able to get to that in our data because we just don't have the behavioral detail, time activity data that I think it would take to tear that apart. But I am curious. Great question. Thank you. I think there was one more.
Yeah. Hi. Can you hear me?
Barely, but go ahead.
I think that's on your end because we hear everybody on the Zoom very well on our end. But I will be brief. Very interesting work overall with either the animal models or your human exposure data. Have you seen any long-term effects? So especially, for example, with the monkeys in the wildfire, that was a one-time event of exposure. What are the long-lasting effects? Because I'm very interested in the DOHAD concept, so the delayed onset of disease and things like that. So have you any information on that across your studies?
Yep. Okay. So long-term effects, absolutely. I mean, both for air pollution and heat, we know these are both chronic and acute exposures, and both matter. And as I described for stress, both acute and chronic stress, they're very different things, and we have to think about them very differently towards health. For the animal studies, like the monkey studies that I mentioned, those are cool because what we actually did was looked at animals who were born during a wildfire year versus a non-wildfire year, and we didn't. And the data that we looked at was actually respiratory function 3 years later. So we were intentionally getting lagged or chronic effects in that study. How on earth they got animals to do spirometry, I'll never know, but it's fascinating what they're able to do with those animals. And yes, like I think some of the studies that I showed, not the Sparks work, but like, for example, the original East Boston work, that was asthma diagnosis over about a 7-year follow-up. So we definitely do see longer term effects of both the stress and the pollution exposure. We just kind of have to carefully think about the temporality within each and then how the temporality relates between the two. So of course, you know, it doesn't make sense to have a pollutant exposure and then a stressor that comes after and hypothesize that the latter increase susceptibility to the former, right? We just have to be thoughtful about the temporality within each and whether or not the biology of stress makes sense that is setting individuals up for having an exacerbated negative health impact from either an acute or a chronic pollution or temperature exposure. So I'm not sure if that exactly answered your question, but I those were kind of the things I was hearing.
Yeah, no, that definitely answers the question. And on the temporarily matter, you can also have second hit, right? Like similar as with the cancer paradigm where you have second hit. You could also see these exposures as second hit exposures. So the stress could, after the pollution, could be a second hit exposure and things like that. So it's very fascinating to tease that out. But thank you for clarifying about the long-term effects.
Yeah, actually, the second hit model is very relates kind of quite nicely here. It's really kind of an underlying susceptibility factor and then a trigger. Yeah.
Yeah.
Okay.
Cool. Thanks.
All right. Thank you.
Great work.
I think we're going to have to
All right.
wrap this up.